Well, COVID definitely doesn't discriminate. So we have patients, in their 30s all the way to in their 90s. And I mean, they can be doing really, really well one day, and then the next, it's just like a steady decline, it seems like, and it happens really fast.
40, he's on 50% total PEEP, and then 59 and 60 are all ready to go as well for your 2 COVID.
The majority of our patients are unvaccinated, and it doesn't seem to matter this time around what your comorbidities are or what your age is. I mean, we're seeing patients that are in their 20s, 30s, that are unvaccinated and on ventilators and otherwise healthy.
And the oxygen is
not. That is not her baseline. I actually had to have her on a non-rebreather this morning.
Yeah.
We did Turner and Cupper, and I suctioned some, got her to cough, and I was able to put her back on 6 liters. I'm hoping she can stay there, but it does look like she kind of decompensates a little at night. We can only do so much on this floor with our skill set and with the materials we have. So if they require more oxygen or a higher level of care, then we have to send them to the ICU where they can get that. The number one thing that they say before we have to send them down is that they wish they had gotten vaccinated.
So I got the vaccine. My husband and I went together and got the vaccine. And 2 days later, my father came down with COVID, and that was on September 2nd. My father stayed at home for a week with COVID and was very, very sick and started getting sicker and sicker as the week went on. And what actually prompted him to go to the hospital was he had the hiccups for 5 days straight. He woke up 48 times in the middle of the night and could not catch his breath. The hiccups would last sometimes 30 seconds to a minute long without a breath of air going into him.
I mean, obviously, if you're not here, you don't realize, what goes into a day for us here. We're just waiting for transport. Okay. These patients are critical. They are the sickest of all the patients in the ICU in the hospital. They require multiple drips to keep them alive. Some of them are on 10 plus drips. They are very unstable, and it takes a lot for, they have to be paralyzed sometimes for us to ventilate them appropriately. I'm going to bring this up to you. They are on heavy doses of sedation and medications. Some of them have to be proned, which is placing them on their stomach for hours at a time, and that, ideally takes up to, 4 to 6 nurses to be able to do that appropriately. So they're sick. They're really, really sick. They're scared. We're scared and worried for them. We do Zoom meetings and set them up and bring it in with their families because their families can't be here. It's emotional. They're tearful, and a lot of them are saying goodbye because they don't know if this is going to be the last time that they talk to their loved ones.
And they put him on the ventilator Sunday morning, and now it's been 5 days since he's been on the ventilator. The first day he got put on the ventilator, he had a really hard time. And I've just been praying to God every day that he would get better and better. It's been 19 days since he's been sick now, and where there's breath, there's hope.
All right, let me check.
This is the first time we've swam him because we just proned him at 6.
Okay.
So
this is his first position.
This is his first position change.
Okay.
It's a learning experience for sure. We're all exhausted. Thank you, buddy. But we come in every day when we work together. We have a great team up here on P6, and we all have each other's backs, so that makes it a lot easier. Was that rapid on our floor?
Yeah.
Do you guys need anything?
No, they got a bunch of people in there. I think we're good right now.
Okay. Constantly checking in with one another. I mean, even just passing someone in the hallway, you always say, are you good? What do you need? What can I do to help you? You're always checking in with one another and just making sure that everybody is getting through the day and the patients are getting the care that they need. What do you need?
Can you pull me 2 milligrams of Haldol?
Yep.
It's tough. We have a great team, good camaraderie and stuff, but it's tough. The nurses are tired, so it takes a toll emotionally, physically on the nurses.
Thank you.
Yeah, you're welcome. And then it, it kind of hits you at the end of the day when everything's winding down. You try to kind of shut it off when you're in here and put your patients first and care for them first. Sometimes it feels like there's no light at the end of this tunnel, but I just ask people to educate themselves. Get educated on the vaccine and educate yourself on the virus and just be mindful.
We're really hoping that people, get vaccinated. That's going to be crucial in stopping the spread, controlling, the amount of patients that are in our ICU, wearing your masks, social distancing, washing your hands. It might seem like out in the public, because things are still open, that maybe it's not as bad as the first time around, but it's worse, and people are more sick than they were previously. There's more people on ventilators, and it's overwhelming to the intensive care unit.
I think that some of the public has an idea. I don't think that all of the public has an idea. I think a lot of people think this is a joke, and it's not a joke. People are dying. Loved ones are dying. My father is 59 years old and had no underlying health conditions. He is a healthy man, and this was not supposed to happen to him. And a lot of people think that it's a political thing. This is not political. And I'm not gonna lie, before this whole thing happened, I was angry that I had to get the vaccine. I was angry about it. But now, 2 days later after I get it, my father comes down with the worst form of COVID that you could get, and now it's affecting me, and it's become personal, and it is not a joke. This is not a joke, and it's not something to mess around with. The nurses have been the most amazing people in my life. I call there and they've answered every question. They've tried comforting me over the phone. I can feel their emotions coming over the phone. And I can't hug my father right now. I can't hold his hand. And they're doing that for me. And so I've tried to make an effort on a daily basis to go on my days off and acknowledge them, the angels that are watching over my father. And so I've been bringing them cards and bringing them just little things that my father would have done if he was here.